that means the cerebral fold, and then at the separating the occipital lobe, which is where vision is processed, from the cerebellum, is the tentorium cerebelli, and it forms a tent-like structure. So the false cerebri fits in between the two hemispheres like this, okay? And the tentorium cerebelli fits between the cerebellum on the occipital lobe like that. So it's a horizontal structure, okay? And it's slightly angled like a tent. And again, we have plastic models of these that I'll bring in from the other room that will clarify that. So if I draw that tent-like structure, it curves around in this fashion. So up here would be the occipital lobe, and below it would be the cerebellum. Okay, so these are folds of dura mater, and so the tentorium cerebelli would be this structure here. And then there's just a slight narrow, it's only about 1/4 inch to 1/2 inch between the two cerebellar hemispheres. That's known as the false cerebelli. Now we just got these models this year, but before we got them, I would make up my own, so I'll go ahead and do that since we don't have the okay, so the false cerebelli and the tentorium cerebelli. So this is the dura mater. All of these structures are dura mater that form a supportive structure for the brain to help keep it from jostling around, as well as containing some of these sinuses. All right, so it looks like this. False cerebelli between the two cerebral hemispheres, tentorium cerebelli between the occipital lobe and cerebellum, and then a little piece underneath that would be the false cerebelli that fits into this shallow space between the two cerebellar components. Okay, so if we put it into place here, it would fit like that. So this should be down closer inside the hemispheres. Okay, so those are the folds of dura mater. And that's what you see here. So this would be the false cerebri and part of the tentorium cerebelli. Because it's angled like that, it has the name tent. So again, these are from Netters. So here is the false cerebri, a little bit of the false cerebelli here, and the tentorium cerebelli has been cut. Now you can see the tentorium cerebelli, because we're looking down from the top. The false cerebri has been cut here where it's anchored to the crista galli. And here's the tentorium cerebelli here on this side. Comes out, this would be the ridge of the temporal bone, All right, and what would be this opening right here? Beginning of the jugular vein? The jugular foramen. All right, so this is where our venous flow is going to end up. So when we talk about the flow of the venous blood and cerebrospinal fluid, it's going to be within channels of the dura mater. So we're going to come back to these channels and talk about those dural sinuses. But what I want to do now, before I name those, is to look at the actual arterial blood flow. So like I said, it's a little bit out of order. So now, let's jump ahead to blood supply on page 50. I'm going to take the blood supply to the brain and then the venous blood drainage from the brain and cerebrospinal fluid circulation. So there are two sets of blood vessels that supply blood to the brain. And we talked about these and named these already when we did the openings of the skull. So what set of blood vessels passes through the foramen magnum? The ones that went up through the transverse foramina of the cervical vertebra. What do we call those two vessels that are found in the transverse foramina of the cervical vertebra, and then they go through the foramen magnum? They're named for the bones they pass through. Vertebral arteries. Okay, so that's one set. That's the smaller set. And the major amount of blood supply to the brain is the internal carotid arteries. Okay, going through the carotid canal. So let's look at, it's a little difficult at first because we're putting a three-dimensional structure on a flat surface. But here are the two vertebral arteries. And they come together on the anterior surface of the brain. And so on this model that I borrowed from next door, because we do this again when we get to 431, here's the anterior ventral surface of the brainstem, the medulla, and the pons. And so here are the two vertebral arteries. And they join together on the basal pons to form a single vessel. All right? So that's what I'm going to draw on the board first. So coming up through the transverse foramina, and then passing through the foramen magnum, we have the two vertebral arteries. Each of these would be a vertebral artery. And then they're going to pass through the foramen magnum and join together on the basal pons. And so on the basal pons, that provides the name for this vessel, which is the basilar artery. A is short for artery. Okay? Now, each vertebral artery gives off a branch on the medulla, known as, they're pretty thin, known by the abbreviation PICA, which is not a little roded, but stands for posterior inferior cerebellar artery. And this is important because it supplies regions of the brainstem that are necessary reflexes for life. Okay, this is going to go primarily to the medulla. And also to the cerebellum, as it says in its name. But the key aspect is to the medulla. Because in the medulla, as we'll see in 3 or 4 days, the medulla oblongata, part of the brain stem, part of this structure that you see right here, has sensors in it for heart rate and blood pressure and respiration. They lose their blood supply and you die, okay? Because your heart's going to stop beating and you're going to stop getting the stimulus for your skeletal muscles to have you take a breath. That's just up inside the foramen magnum. So it's in the skull, but along do you remember in the skull how the occipital bone led up to the sella turcica? So it rests along that area.
And that's where, if it's cut off, then
that's one of the causes. So babies can be born without the cerebral hemisphere and only have the brainstem functioning. So they'll have just a very thin wall of the gray matter. They won't have cognitive function. They used to be called anencephalic, which meant without a brain. And they do still have a very thin wall of cerebral tissue. But if you were to look at this diagram here, it would just be, all of this would be empty. Okay, just a thin amount of nerve tissue out here. But if they still have the brainstem, they're in essence still alive. They're going to still be breathing and the heartbeat will still occur. Many of them will die just prior to birth. So it's one of the causes of in utero death. When I was working in labor and delivery, about the last week or so before I moved out here for graduate school, we had a woman who came to labor and delivery through the emergency room. She was in labor. She hadn't had any prenatal care. And she was sent up to labor and delivery. And we attached a fetal monitor. And within about 10 or 15 minutes, the baby's heart rate started dropping. Normal is between 90 and 160. And it had started out at 120, and it was dropped below 90. So an emergency C-section was called, and when an emergency C-section is done, they don't do any epidurals, they don't keep the mother awake. She's put completely out, and they do a really rapid incision from top to bottom instead of trying to maintain a bikini cut. So when the doctor pulled, it was the same doctor that admitted her through the ER, when he pulled the baby out, he just kind of swore. We called the pediatrician since it was an emergency C-section, and I was working with the pediatrician, and the baby had little flippers for arms, upper extremities, and little flippers for legs. By flippers, kind of a paddle shape, which is the fingers kind of attached, and the back of the baby's head was slanted like this because it didn't have the development of the cerebral hemispheres. And the baby was still breathing, but within about 4 minutes, the pediatrician gave me the stethoscope to listen to. It was just getting slower and slower, which had started to happen before the baby was born, and then it stopped. And the doctor actually put the baby was born without a heartbeat, which wasn't true. I guess so he didn't have to justify no resuscitative measures. So these babies sometimes can live for hours to weeks to months afterwards. I read one case where the parents were told, your baby's going to die within a few weeks. They were able to take her home, and she actually developed this brain tissue after birth, and she was able to walk and talk, and she developed normally, and that's unheard of, okay? Because typically these babies will die within minutes to days after birth. They are often the hearts that are used for heart transplants in infants. So the mothers often will know that their baby, the parents will know that their baby doesn't have the brain except for the brain stem, and they may or may not choose to have an abortion, and they're offered the opportunity to donate their baby's heart. And so my sister used to work pediatric heart transplant down at Loma Linda University, and she said more than half of their patients came from Canada, and both the baby that needed the heart transplant and the baby that and they would either be on life support or the parents would come down and have the babies delivered at the hospital knowing that one baby wasn't going to live and the other baby needed the heart.
Would they have to carry it to term?
Mm-hmm. Yeah.
Knowing that.
Knowing. Yeah.
Oh. So you have to be really.
Yeah. So they would have already made the decision that they were going to donate their baby's heart. Or not. But with the ultrasound, they would know that the baby wasn't going to be able to live. With the baby that I was involved with, when that happens, or a baby dies within or soon after birth, the parents, the mother is usually put on a different ward floor, so she's not there with the other babies and mothers. And the next day, I was working with the mothers and the newborns, and I got a phone call saying that this woman wanted to see her baby. And so I asked if the pediatrician or the obstetrician had been to talk to her, and they said no. And so I was kind of mad. But I went to the nursery and I got a blanket out of the warmer, went down to the morgue, and of course the baby had been refrigerated. It hadn't been autopsied, and so I wrapped it up in a warm blanket and just the face showing, and took it to the mother's room, and her aunt was there. She had just had a divorce, so the father wasn't in the picture. And I held the baby while they looked at it, and they talked about which side of the family it belonged to. And then she said, I was told that my baby was deformed, and I thought he would look like a monster. And I said, no, and I unwrapped the blanket, and I showed her the flippers and the limbs. I didn't show her the back of the head, but I then gave her the baby to hold, and she didn't elect to pull the blanket back from the head. And I said, you know, he doesn't have the normal extremities, but he's certainly not a monster. And that was really bad for the doctors. Because she would have believed much worse. She had a baby that looked like a baby, and she could actually find family resemblances. But without the development of the cerebral components, like I said, it wouldn't have any cognitive, and it had enough of the brainstem with this blood supply to have respiratory and cardiac function, because that's where those reflexes are occurring. So the pica artery, if there's a stroke there, if there's a rupture or a blockage, then that's going to result in instant death, because it's going to block the blood supply to those specific functional components. And when we talk about brainstem in the next few days, all right, we'll come back and talk about those areas in more detail. All right, so the basilar artery ends by forming two terminal branches, kind of look like a T. And these are going to go out to the cerebellum and to the occipital lobe, right? These are known as posterior cerebral arteries.
You said this is where the basilar ends?
Yes, that's how it ends. It's those two terminal branches. They don't end it like that. They're going to continue back around. And they go to the cerebellum, again, and the occipital lobe, because those are posterior structures. The occipital lobe is where we process impulses from the eye for vision. Okay. So that's the major supply of the vertebral arteries. There's smaller branches that come off the basilar artery that I haven't indicated. Most of the blood flow to the brain, however, is from the internal carotids. So we have the common carotids coming up the neck, and then about the level of the jaw, they branch into external that go to the face, all right, in the back of the skull, and the internal that go up through the carotid canals and supply most of the rest of the brain tissue. So we're looking kind of down onto the surface. This would be the inferior surface of the brain. So the internal carotid arteries are kind of coming up like this. And so we're going to cut them, where they're going to come up in this direction. So those are the cut edges of the internal carotid arteries. And they give off two major branches. One is the middle cerebral artery. And it passes between the lobes of the brain. So you can see on this model here. Here's the cut internal carotid artery that's coming up through the skull. And this major branch is passing out here and then onto the outer surface of the brain. So it's going to supply the frontal lobe, the parietal lobe, the temporal lobe, all of this outer surface, okay, the majority of the brain tissue. So when someone has a stroke and they lose their ability to speak, or they have paralysis of the upper limb or both limbs on one side, it's usually a part of the middle cerebral artery that's affected. So if any of you are doing the case study on stroke, part of the assignment is to go through this same blood supply that I'm going through now. So the middle cerebral artery going to supply frontal lobe, parietal, and temporal from the external surface. Then there is a small branch of the internal carotid artery that passes forward and on the medial surface. So this blood vessel that you see right here passes this structure right here are neurons that connect the two halves of the hemisphere, and this goes over and around them and does this medial surface of the brain where the false cerebri is. And so that's a branch that goes between the two hemispheres. And these are the anterior cerebral arteries. So we have anterior, middle, and posterior cerebral arteries. And it's going to supply the medial surface of the brain. These same lobes, but they're medial surface. Okay, now, so far we have two separate systems. Okay? But you could have almost 90% of both internal carotid arteries blocked with plaque and not notice any symptoms. Because as pressure backs up in those vessels, increased blood flow will come up through the vertebral arteries and is able to supply the rest of the brain, but not the way I have it diagrammed. So we have to have some connecting vessels, and there are three. Connecting the posterior cerebral and internal carotid arteries, we have posterior communicating. So there are a pair of these, and that connects the vertebral system to the carotid system. And then connecting the two anterior cerebral, we have a single anterior communicating that bridges that and connects it left to right. Okay. So this forms a circle. And its old name is the Circle of Willis, because it was named after the man that described it. But we're getting away from giving people credit for things that they describe. And so now it's just called the Circle of Willis. So I have a couple of views of it here. Sorry. So here would be a vertebral artery and the basilar artery, posterior cerebral, posterior communicating, the internal carotid artery cut, middle cerebral, anterior cerebral passing between the two hemispheres, and anterior communicating. Okay. So we have one of our cadaver's brains I'll bring in during lab. And you might want to bring some gloves next week because I'll bring it back again and you can examine it. It looks like this. You can see this is the basal pons right here, this swelling. It looks like a pregnant belly or a beer belly depending on what gender you are. And so that's where we get the name basilar because it's going over the basal part of the pons. And then this posterior cerebral structures here. This is optic nerve right here.
Which one?
Right, this structure right here, where it's cut at the optic foramen. And so that's the relationship between the anterior communicating. Okay? So, again, vertebral, basilar, posterior cerebral, posterior communicating, internal carotid, middle cerebral, anterior cerebral, and anterior communicating. So we have a skull, you can see it looking down inside the skull, or this is a view looking onto the brain. So it kind of just depends on which way we look at it. Right? Now, these blood vessels are found on the surface of the brain and pass between the folds of the brain tissue and sends smaller blood vessels into the brain itself. And those break down into smaller vessels yet, into capillaries. And then as the capillaries give off their nutrients and oxygen and pick up carbon dioxide, they reform as veins. And the veins come back to the surface and are seen within the dura mater. Are seen within the pia mater. So as we look at this view again, back on page 38, here is the pia mater, and here are the arteries and veins within the pia mater.